The World Malaria Day is a worldwide effort to raise awareness and to increase funding for the treatment and prevention of the disease.
And in the area of prevention, the World Health Organization says Nigeria will be one of the countries that will benefit from the new malaria vaccine, which is already being tried in Malawi and Ghana.
Now, TVC's Kemi Balogun has more on this story.
The World Health Organization is using this day to put the issue of prevention of malaria at the forefront of global advocacies. This is with the aim of significantly reducing the massive yearly global death toll of 400,000 people by the year 2020. In Nigeria, malaria remains a key public health problem, with 60% of the burden reported at healthcare facilities. According to UNICEF, Nigeria accounts for the highest malaria burden, responsible for 30% of estimated deaths in children and 11% among pregnant women.
Joining us now from Abuja studio is Dr. Linda Ozo from the Malaria Focal Point Office of the World Health Organization's country office. Dr. Ozo, it's good to have you join me right now. Everyone is cheerful about the breakthrough in the vaccine against malaria, although Nigeria is not amongst the first countries to benefit from this. But when it comes to Nigeria, eventually, how successful is it going to be? Because right now we hear of resistance to drugs.
Good morning, and thank you for having me. The vaccine definitely is a great breakthrough in the world of technologies and indeed in health. And in 2016, WHO identified the potentials that exist within the vaccine, and there were recommendations to have a pilot introduction in three countries. Malawi, Ghana, and Kenya. The reason for this introduction is to use the pilot study to gather further information and evidence on feasibility of introduction through the routine immunization systems. And so we hope that at the end of the trial, at the end of the pilot, we would have gathered enough information, evidence, and WHO will be able to probably make recommendation on public use of vaccine. For now, it's only on a pilot use and not recommended for public use.
All right, we assume when it comes to Nigeria, it might be recommended for public use. But when it comes to accessibility, what are the programs? What are the projections or the template for making the vaccine accessible and maybe affordable for any average person who needs to get it?
Like I have mentioned earlier, the pilot is going to help understudy some of the challenges that may come up with the vaccine, including the introduction, the feasibility, and all the operational issues. In terms of funding and financing for the vaccine, I'm sure this will be taken care of as part of the overall vaccine process. And governments would have to determine how to finance the facility, definitely with maybe with the support of international communities.
All right, Dr. Linda Ozo, thank you very much for talking to us on TVC Breakfast. World Malaria Day is a worldwide effort to raise awareness and to increase funding for the treatment and prevention of the disease.
And in the area of prevention, the World Health Organization says Nigeria will be one of the countries that will benefit from the new malaria vaccine, which is already being tried in Malawi and Ghana. TVC's Kemi Balogun has details.
The World Health Organization is using this day to put the issue of prevention of malaria at the forefront of global advocacies. This is with the aim of significantly reducing the massive yearly global death toll of 400,000 people by the year 2020. In Nigeria, malaria remains a key public health problem, with 60% of the burden reported at healthcare facilities. According to UNICEF, Nigeria accounts for the highest malaria burden, responsible for 30% of estimated deaths in children and 11% among pregnant women.
If we need to control malaria, let's reach to everyone, to the communities. And a lot can be done in terms of the community. One important thing is the message. That is very important for the communities to prevent themselves. What do I do to make sure I don't get bitten by mosquitoes? This is very important. The second thing the communities need to know, we need to present them facts in terms of people who are affected, women, children dying from malaria. This will help them to have informed decision in terms of behavior change, but also accessing services.
The World Health Organization says new trials of the malaria vaccine will also help Nigeria a great deal. Trials of the RTSS vaccine has begun in children in Malawi, while Kenya and Ghana will follow soon. The goal is to vaccinate about 360,000 children in a large-scale pilot project.
It's a very important tool that will also help to control the vaccines, but we cannot scale it at once in all the countries. You know, these are vaccines, as they get used, they're also evaluated, and they make sure that definitely this is important. Nigeria is a very important country, among the high burden country. This has not been thrown out of. It is an option that definitely will be considered. But as of now, let's look at the strategy that exists. The government has already deployed. Let's do more, scale up on the response, and then things will be better.
In an earlier trial, the vaccine reduced the number of clinical malaria cases by about 40% and severe malaria cases by 30%. Kemi Balogun, TVC News, Abuja.
All right, I have with me here medical doctor, Dr. Tui Mebawandu. He's here in the studio to give us insight into all this. Good morning, it's nice to see you.
Nice to see you.
Now,
too.
in commemorating this year's World Malaria Day, we would say that the much-awaited breakthrough in the vaccine against malaria is here. How much of cheer is that in the health sector across the world, or even maybe in Africa?
Again, quite cheerful, if I may say, but let's appreciate the fact that we're at level 3 of phase 3 trial at this point, where you have to scale up to as much as 300,000 people, and then you have to do phase 4 and see what effect really this vaccine is going to have on the populace. We look at it until we're able to connect the malaria endemicity to poverty, which is obviously so, then we'll understand what we're losing every day from malaria. Now, besides that, we've seen countries, smaller countries, that have moved from malaria control to malaria eliminations. Smaller countries. But I think that our ambition sometimes is quite tokenish. You know, you've seen Jamaica is moving, it had actually moved away from elimination to preventing reinvention, you know, of malaria, reintroduction of malaria parasite.
How are these countries doing this thing? What is that special thing they're doing?
First of all, you need the political will.
Okay.
You need the political will. You need a concerted effort, because we have a broken health system. If you have a broken health system, that is why, for instance, when the expansion of interest was being sought to see where to try the vaccine, Nigeria was not included. Why? Because our immunization schedule is broken. Our health system is broken. So you need a country that has a good malaria control program and immunization schedule to be able to try these vaccines, okay? But for us, ours is broken. So,
all right, now with this breakthrough right now in the vaccine, we've been waiting for this for close to 30 years.
Yeah, 30 years, exactly.
It's available now. Are we seeing that the likelihood of maybe in the next 10 years or in the next 15 to 20 years, malaria can be wiped out anywhere in the world? Is it possible? Now, is that what we're looking at?
Yeah, presently about 27 countries, you know, they've been able to eliminate malaria. Yeah. We're moving to eradication. After we think that this vaccine will be the necessary impetus to push us and drive us to achieving that elimination in countries and finally eradication. So we hope it happens. But I tell you, there's also quite a number of aspects that we need to do. We have not gotten our malaria control in shape. We are dealing with resistance in terms of drugs that's being used, resistance in terms of pesticide. If we, the indoor residual spraying, the chemical we use, those things are mutating and having resistance. These are key issues.
Posing a challenge
we
to
are
the
dealing
cure
with lack of finance.
All right, now, Doctor, before I let you go now, with this test in Malawi, to go to Ghana and then Kenya, Nigeria is not in the first batch, like you said earlier on. But when we talk about this vaccine being available, when it comes to Nigeria, with the state of health that you said we have a broken health system, how challenging is it going to be for the vaccine to appropriately function in Nigeria?
It will be a challenge. You see, Nigeria and DR Congo is responsible for as much as 36% of world burden of malaria, 2 countries. 36%. Now, it's going to be a challenge because, wait a minute, where are the human resources? I heard the other time a minister was saying that we have XX doctors in Nigeria. Yes, maybe he's right. We have native doctors, we have alagbos, we have all of other people, who are actually, maybe they're going to give this work to those people to do. We don't have human resources to really do that. And besides, in terms of the precincts and the rural areas, there are no health human resources to deal with those things. All right. So we need to put those things right. And that is exactly what those things rely on, because you have about 4 doses of that vaccine to take if you want to be effective.
We have a whole lot to look at, certainly, as a country going forward. Dr. Tuime Baondu, thank you so much for coming.
Thank you, sir.
Thank you.